Everybody's staying healthy. Obviously, this is a really difficult time to be going through kind of the residency process. So I know I speak for everybody, I think, in the PM&R community when I say that we're all here to help. Don't hesitate to reach out if there's anything that we can do here at MCW or I'm sure anywhere to make this process easier. A little bit about myself. I grew up in Georgia. I did all of my undergrad and medical school in Georgia, and then fell in love with the MCW PM&R program on interview day, decided to brave the tundra and kind of move up here from Georgia, and I really haven't looked back. A little bit of background, we are an advanced program. We have 6 residents per class, 18 residents total. We come from all over. Do tend to take more from the Midwest, but obviously I'm from Georgia. We have a Canadian, a fellow from California, so we really take from anywhere. And to look at our program leadership, we have Dr. Ketchum, who's our program director. He might be here tonight to help answer questions if they come up. And then Associate Programs Director, Dr. Goodfriend on the PED side, and Dr. Katsonis, who works over at the VA. One thing I'll say about this leadership team is that all of them are super interested in medical education and kind of bend over backwards to make this the best program that they can make it. Super responsive to resident feedback, which is one of the things that I love most about this program. And a couple other important people. Sue Abrams is our program manager. She's extraordinary, kind of keeps the day-to-day operations of the program alive. And then Dr. Brazda is our chair. She's a prior program director for MCW. She trained here, did all of her med school and training here, and sits on the board of the AP PM&R. And if there's one thing to say about Dr. Brazda, I just want to give her a shout out for being like maybe the most approachable chair that I've ever interacted with. We've had a book club at her house, and she's always making sure that the residents are happy and healthy and everything is running smoothly. I think kind of as a holdover from her days as a program director. So truly exceptional chair that we have in Dr. Brazda. Looking at the training sites, we have 3 main clinical sites, then a couple clinics scattered around. Nothing more than about a 15-minute drive from the main campus. So we do a lot of our training at Frederick Hospital, which is a large level 1 trauma center located in a city called Wauwatosa, which is just outside of Milwaukee. It's a 735 bed level 1 trauma center. Very busy cancer center, a pretty busy transplant program. You'll see pretty much anything that you could imagine seeing at Frederick. Children's Wisconsin is another level 1 trauma center, really big, busy, very well-ranked children's hospital, which is physically attached to Frederick through a tunnel system. And then we also do some work at the VA, which is about a 10 to 15-minute drive, unless you are like me and tend to get lost most of the time. This is not actually the hospital building. I just think this building is beautiful. The MILWAUKEE VA, I think, was the 2nd VA in the country to open, and the campus is gorgeous. So the building that you actually work in kind of looks like a hospital or a VA, but if you get time to like walk around the campus at the VA, it's incredible with these old buildings and green spaces and all this stuff. The other great thing about the VA is that it's located within walking distance to Miller Park, and we actually get free Brewers tickets on Sundays if you work at the VA. So there have been Sundays when I've been on call and then I mosey over to the Miller Park and catch part of a Brewers game, which is pretty great. As for our design, most of our rotations are 2-month rotations located at one of those 3 sites. At Frederick, currently we have an in-house rehab unit. We are soon transitioning to a standalone rehab hospital, which is going to be a big and I think very positive change for the program that I imagine will be kind of underway by the time that you guys will be coming in. At Frederick, our inpatient months are grouped by diagnosis, so there's an SCI service, a neuro rehab service, and a kind of general service, which deals with amputations and transplants and those sorts of patients. The VA units are split into spinal cord and non-spinal cord. So on our VA inpatient unit, you'll see some patients with stroke and some with TBI, some patients with amputations kind of all in the same morning. And that variety is pretty nice to get it all at the same time and keep fresh on all of those different kind of topics. And then if you look at the kind of more general breakdown of the program overall, we do have 12 inpatient months, 4 consult months, and then 20 outpatient months. We do have 4 elective months included in that, split between PGY 3 and 4 years, and between the VA and Frederick. And then we have 4 months of EMG, which is again split between PGY 3 and 4 years, which is kind of nice because it means as a PGY 4 you get some good teaching opportunities for the PGY 3. We also have relatively, I think, more spinal cord injury training than most programs. So we have 2 months at Froedtert, which is more acute spinal cord injury management, and then 4 months at the VA, which as a general rule are more chronic injuries, though we do get some acute spinal cord injuries over there as well. Our call, which I know was really important to me when I was applying, we have a home call system right now. Basically, there are 2 types of call. There's week call, which is Monday through Thursday in the evenings, covering the VA and Froedtert services. And then weekend call, where basically you cover one or 2 of the services from starting at Friday at 5 p.m. and then lasting to Sunday morning. Call burden, like I'm sure is true at most or all programs, decreases as you move through. So 12 weekends, 5 weeks as a PGY2, and then as a PGY4, there are no week calls and about 5 weekends. The great thing is that if you're not on call, you are off. So, even PGY2, which is a relatively larger call burden, that's, 40 weekends out of the year that are totally your own. And also very rare to have to come in after hours. I've never done an after hours admission. I think I've come in maybe 4 or 5 times in my residency, which is average or a little bit more than for most residents. Looking at our educational activities, we're all really excited. This year we're moving to a 12-month academic half-day cycle, kind of a 12-month didactic schedule, which is a change that was sort of pushed for and requested by the residents, and that the program leadership took it and ran with it and turned it into this really exciting academic half-day schedule that we're all really excited about. And one of the coolest things about it is that we're planning on doing what we're calling Workshop Wednesdays. So basically we'll have a month of didactics on a topic, and then at the end of the month there's going to be a hands-on workshop related to that topic. So after a month of learning about stroke rehab, we'll have a hands-on spasticity management kind of hands-on workshop, which will be, I think, a really neat way to get some hands-on kind of nitty-gritty training. In addition to the weekly academic half days on that 12-month cycle, we have year-long didactics. So for PGY2, it's anatomy and physical exam. For PGYs 3 and 4, it's EMG didactics. And to segue here, I think our EMG nerve conduction studies training is maybe one of my favorite parts of this program. It's absolutely top notch, and a big reason why is because we have these didactics which start at the beginning of your PGY3 year, last through PGY4, and it's just time to sit with your co-residents and friends and talk through cases and how to think through electrodiagnostic studies, and it's super fun. In addition, we have monthly faculty-led board review, and we have a journal club that I'll talk about a little bit more, opportunities to present cases with your co-residents, and then M&M. So just some examples of some of our educational activities that are fun. So on the top left, you will see one of our APDs testing a blink reflex on our program director, which was a big joy for all of us. The middle 3 pictures are pictures from our prior spasticity workshop. And then top right is our journal club, which I wanted to highlight. Obviously, this is before COVID, but I love this part of our program, and I'm sure we'll get back to it. But every quarter for journal club, there would be a faculty member who hosted. It was a time for us to get to know the faculty and their families a little bit better, and then kind of have a more informal journal club. So here you'll see me. I have just lost Jenga, meaning that I have to present in this ridiculous cheese hat. It was a really fun night early on in the year to get to know the new PGY2s and talk about some PM&R topics. We also do have some ACGME and non-ACGME accredited fellowships. We have a pain management, spinal cord injury fellowships. We have a sports medicine fellowship, which is through the Department of Orthopedic Surgery, but the program director is PM&R trained and did her training here. So it's a PM&R friendly program. And then we have a really unique non-ACGME accredited fellowship, which is our neuro rehab and spasticity management fellowship. I would think it's one of only a couple in the country that's really intensive fellowship focusing on spasticity management. Not too many other opportunities like this around, which I think is really great. And so just as an example, looking at last year's class, one resident went on to do a pain medicine fellowship at Minnesota, 3 went on to do sports at MCW, Utah, and UIC. One person is doing that spasticity fellowship here, and then 1 went out into practice. And both of our spasticity fellows from last year got some pretty solid jobs. And last year we did have a 5-to-1 kind of fellowship to practice ratio, but obviously it changes year to year. If you look back, there are years where more people went into practice and there have been even splits. So I think that's just a variance from year to year. And then another really cool thing, I might be a little biased here, but I think this is a really cool thing about our program, is we do have these longitudinal tracks. It started with the research intensive track. This is for residents who want to get their hands a little bit more dirty with research. Obviously, I think all residencies have a research requirement, and all residents here are expected to present a research topic at the end of their training. But for residents that are interested in taking on a bigger, more prospective study, they can apply and participate in the research intensive track, which gives them additional protected time funding and a little bit of extra mentorship to get those bigger projects underway. And it's been, the residents that I know who are participating in this have been super successful. And then I approached the program leadership about starting a medical education track as a PGY2, and they kind of took it and ran with it. And we now have this medical education track that I'm moving along as the first resident on it. So for residents who are interested in academic medicine and medical education, gives a few more opportunities to get involved with teaching opportunities for medical students like nursing staff and therapists, and then other residency programs. So for example, I've given some talks to the internal medicine interns and residents about MSK exam and things like that. Again, I'm provided with some protected time to work on these projects and support to present at a national conference, as well as support to participate in a really cool faculty development course that focuses on medical education, actually. And then we also, as part of this, started up a Med Ed Journal Club, which is also similarly like very fun time to get to know people who have similar interests. And then kind of shifting to talk about life in Milwaukee. Like I said, I'm from Atlanta, kind of the Atlanta area. I love Milwaukee. I fell in love with Milwaukee. I think it's kind of the perfect size city. It's 600,000 in the city, 1.5 million in the greater metro area. In my opinion, it's just enough that there's everything that you would want without really being so large that you have to deal with traffic, which is, coming from Atlanta, all I really care about. It's the largest city in Wisconsin. It's located on the lake, which is beautiful. I didn't realize, but we have beaches, which is crazy to me. And then if you want a little bit more, you can take a 90-minute trip to Chicago. There's also an Amtrak, and other cities are within a pretty short drive. So I included a YouTube video here for anybody. These slides are posted somewhere, wants to go take an aerial view of Milwaukee. This is the lakefront. Like I said, it's crazy that this really does feel like a beach. The bottom right picture kind of makes me cringe a little bit with COVID, but before everything shut down, people would go out in the summers. This is Bradford Beach, and play beach volleyball and go swimming. It's a great time. We have beautiful seasons, which I thought were going to be really difficult, but they're actually really fun. Falls here are beautiful, and the winter is actually pretty fun too. And then I think one of my favorite things most of the time is that because the winters are a little rough, people love the summers. So most of the time, every weekend in the summer, there are festivals. So there's Summerfest. If you haven't heard of Summerfest, you should look up Summerfest. It's a huge music festival. I've never really seen anything like it. There's, Oktoberfest and Pet Fest and Pride Fest and, anything that you can think of. Usually there are multiple fests going on in a given weekend, and everybody just kind of comes together in the community to have a really great time in the summer. We got some great sports teams. The Brewers are looking a little rough right now, but I'm sure they'll get better maybe. People are really into the Bucks. I'm not huge into sports, but if you are, there are plenty of opportunities to watch sports, be involved with sports, etc. And then other activities, obviously all these things, maybe I imagine other programs do these things too, but there are a couple that I wanted to highlight that I think really speak to the cohesiveness of our program. We do have these yearly Brewers games, which are with our nursing staff and therapists. So every July, the charge nurse on our rehab floor invites all the residents, basically anybody who touches the rehab floor, to go out to the Brewers games. It's a time to get to know the new PGY2s. I remember going as a new PGY2, and I got to know all of the nurses really well and the therapists, and kind of changed my relationships with them moving forward in a really positive way. And I can't think of any other field really where that would happen, and I just think so highly of those opportunities. And then another thing that we started to get together as a department and spend time together with the residents and attendings and nurses and therapists was third Thursdays. We would go out and either go to a restaurant together or a brewery, or one time we went to an impromptu Bucks game as a group. And obviously we can't really do those things anymore, but it shifted into a Thursday night Zoom happy hour where, again, everybody's invited to come hang out and stay in touch and catch up, which has been really nice. Other really important things to highlight, the Dr. Lee, who's the director of our spinal cord unit at the VA, also oversees the National Veterans Wheelchair Games and their winter competition as well. So our residents have a really unique opportunity to get very involved with wheelchair athletes, adaptive sports, especially in the veteran population. So every year we have a group of residents who go out to these events. It's a really cool, unique opportunity that our
Hey, Charlotte, I got 5 minutes left.
Cool, thanks. That kind of Dr. Lee being involved with our program kind of opens up this realm of possibilities for us. Other resident activities and resident fun. So this top right is actually pictures from that Brewers game that I was telling you about. More shenanigans with our EMG didactics, and then we have retreats every year. I think the top left is from a retreat the year before I came here. Bottom right is one of our Tai Chi didactics experiences. I mentioned the resident retreat. I won't kind of belabor this, but every year we go on a fun adventure. Last year we went to Six Flags, and the year before that we went to a trampoline park. Just building up again resident cohesiveness, and we have a ball of a time doing those things. Super family friendly program. We had a ton of, I wish I had counted, we had a ton of babies in the program last year. The program is very supportive of families, and there's a lot of stuff to do around Milwaukee as well for families and kids. Few pictures here. I won't kind of spend too much time here because I want to be able to get to questions if there are any, but as far as kind of common places to live, this is the historic third world and third word. And then again, a view of the lake, and then Wauwatosa, which is where the hospital is actually located, is this like delightfully quaint little town. If you ever get a chance to visit, it's super cute. So in short, I want to get to questions, but I love Milwaukee. Milwaukee is an incredible city to do your training. It's easy to get around. You don't have to worry about traffic. Everything's like 15 minutes away at most. And there's a ton of stuff to do here. And if there's not enough, you can go to Chicago. Our program leadership is amazing, super responsive to feedback, very, very, very approachable. And our training, I would say, is exceptional across the board, especially in the realms of neuro rehab and spasticity, EMG, and spinal cord injury. We do well looking forward as far as like fellowships and jobs. And then there's nothing that can compete with the people here, which is kind of the main reason why I fell in love with this program to start with. If you have any questions, literally any questions about MCW, like PM&R applications, anything like that, don't hesitate to reach out. My email's here. My co-chief couldn't make it tonight. His name is Nick. His email is there as well. He says that anybody who has questions can reach out. I included our program manager, Sue's email. If you have any specific questions about a particular field or research interest or clinical interest and need to know who to get in touch with, just ask. There's the slide set that's posted has a couple extra slides that didn't fit here because of time. But in short, the moral of my story is we're all here to help. And even if it's not specific to MCW, just reach out.
Awesome. Well done, Charlotte. We have exactly 2 minutes for questions. So if anyone has questions, go ahead and speak up, or you can drop them in the chat.
How did I adjust to the winters in Milwaukee? Great question. It was a change for sure. I remember it was like mid-September, and I had like just bought my big down coat, and I was sitting outside in mid-September in my big down coat, and I was horrified about what was to come. They're not bad. I actually kind of look forward to them and like them. I mean, the snow is beautiful. Shoveling is a change, but it's not bad. Yeah, I think what I always say is the winters here are, I would say, sometimes easier to tolerate than the summers down south. So there's always a trade-off. How many beds the new rehab center will have? Dr. Ketchum, if you're on, do you know the answer to that question?
It'll be a 50-bed rehab hospital. Once we open, we'll start with likely 30 beds, which is similar in volume to our current inpatient capacity at Frederick Hospital. Could you hear me okay?
Sports coverage opportunities. I'm not super interested in sports, so Dr. Ketchum can supplement this. I would say sorry, go ahead.
So typically college sports, University of Wisconsin, Milwaukee, Milwaukee School of Engineering, Mount Mary University, and then various high school sports are available. There is Concordia University hockey. So there's a mix of high school and collegiate level exposure for our PM&R residents. And then additionally, some of our residents have set up more professional cycling coverage as well locally also.
Lots of race coverage, like marathons and things like that. I did a little bit of that. And the other thing is that residents can kind of seek out their own sports coverage opportunities. So we have a resident who's really interested in ski racing, and he found a faculty to sponsor him and go help out with ski racing, which was pretty cool. I got a question about when the freestanding center.
I am sorry, we have to move on, but I will say, Charlotte, if you want to answer that in the chat, by all means, go ahead. We just need to go on to the next one. I'm